there is a drug. It's an arthritis medication. It's called tocilizumab, and there's a lot of studies happening on it. This was, I think, one of the earlier ones, but now there's people looking at this, and there's, when people get hospitalized, they're giving them this, and they're showing a 90.5% of the patients recovered after 13 and a half days. That's pretty high. Again, not 100%, but 90.5% of patients by giving them an IL-6 receptor antagonist. All right, that's amazing. So again, this talk is a good. I'm going to give a lot of positive news. Science is amazing. They're coming up with great things. It's not, a lot of it is not making it into the news, but I see a light at the end of the tunnel, is what I'm basically saying. Also, again, since this is an inflammatory disease, COVID is an COVID death, or what we call severe COVID, is an inflammatory disease. It's an inflammatory process. So we want to decrease inflammation. That's our goal. If someone asks you, Doc, what do I do? Quickly, you say you want to decrease inflammation. How do you decrease inflammation? With anti-inflammatories. What's a known anti-inflammatory? Steroids. So we can give steroids in studies where people are hospitalized and in very bad shape. We reduce deaths by 1/3 of those people that are receiving ventilation, and 1/5 decrease those receiving oxygen. What do I do with my patients? I tell them this stuff. I create a value. When they see me, they think they're just coming for me to see their teeth. I attack the big elephant in the room. I point it out. I say, how are you doing with COVID? I talk about COVID with every patient. I talk about what vitamins they need to be taking. I talk about how to survive, how to live, what they need to be doing. They love it. They say, Doc, could you write that down for me? Thank you so much. You're amazing. All of a sudden, more important in their eyes at that moment of their life when they need it the most than their medical doctor. Their medical doctor didn't give them that advice. I did. So you better believe that's going to be a practice booster. If you're part of the process of enlightening someone of, hey, do you know why people are dying of COVID? I asked that to my patients. I said, do you know why people actually die? They're like, no. I'm like, it's IL-6 and this inflammatory, CRP and a lot of these inflammatory, I say, do you know what a cytokine is? No. No one knows what a cytokine is. Do you know what cytokine storm is? No. Did you know COVID, people die of inflammation? No. Nobody knows this. It's interesting that nobody knows this because it's so important. And this is very interesting. So there is a doctor in somewhere in Texas that's been talking about this, and he basically is talking about how there's a lot of studies now being done on this. But basically, again, if it's an inflammatory process, okay, steroids, when you take steroid pills, also steroids have the lowering immune system effect too. It lowers the immune system, but it decreases inflammation, which is very good right now. It lowers IL-6 levels. So, but if you're, let's say, I'm going to give you the analogy. If you're a firefighter and you want to put out a fire, you don't want to wait later on when the fire is there, it jumped over the freeway and it's on that, and because then it's very hard to put out this fire. So you want to get it locally. And again, where does this disease, where does COVID start? It starts in the nose and in the mouth. So why not, let's inhale steroids like asthma medication, budesonide or cyclosinide. These are inhalable with a nebulizer. You put the nebulizer here, that's the little mask that people breathe in, and they breathe in a steroid, and it's like a firefighter right away. They see a fire, going to the source, putting it out. Never even goes anywhere. So this is looking very promising. Data is being done, but there's some good news coming out of this. I would Google this, learn more about it, because they're actually doing this in a couple of countries, and I think it's like Taiwan or Japan. You know, a couple of the countries that are doing really well are actually doing this, and it's working really well. So hydroxychloroquine, actually, there was a study. Again, the best studies are simple studies, not when they get too cute and complicated. They just took people, the study, they gave one group hydroxychloroquine, one group they didn't. They checked their IL-6 levels. Easy, beautiful study. Showed a significant lowering of IL-6 levels in people who take hydroxychloroquine. Now, biologic mechanisms. And if anyone has any questions, they can save it for the end. You could write it down on the side or save it for the end, and then we can answer them. But biologic mechanism. So this is kind of how the disease happens locally. We have the inflammatory mediators locally. We get activation of the immune cells coming in, releasing the IL-6 locally. Also, we get straight bacteria going into our bloodstream, or bacteremia. Okay, that also upregulates inflammatory mediators throughout the body, throughout all of our blood vessels. When bacteria flows through it, it also further activates more IL-6 later on. So you have multiple opportunities, so to speak, for this to happen from the gums. Let's talk about that. Now, how is it getting into our body? We can, as actually Dr. Akami spoke about earlier, you can aspirate these bacteria through, just inhaling into our lungs, and they could adhere to our lung epithelium, and the aspiration of secretions from the oral pharynx into the upper and lower airways. They can adhere to the respiratory epithelium and initiate or exacerbate infection indirectly through the release of that LPS, or that weapon that the bacteria have. We have enzymes that are produced in periodontal disease, can alter the surface of the respiratory epithelium. So you have also this direct link of going into the lungs. And also you have this through the enzymes and through aspiration, through swallowing. You have the cytokine can modulate bacterial adhesions of pathogens to the pulmonary epithelium. And studies have suggested that bacteria or bacterial products of oral origin are able to induce secretion of cytokines from pulmonary epithelial cells, which leads to the recruitment of inflammatory cells. And the inflammatory respiratory epithelium can turn or become more susceptible to infection due to epithelial inflammation. Some oral pathogens are able to stimulate epithelial cells to produce pro-inflammatory cytokines, similar to that degree observed for respiratory pathogens. So let's talk about further something called gut dysbiosis. So we have this, when we swallow, we can swallow and have bacteria go into our gut. This causes what we call a dysbiosis. Dysbiosis means it's an imbalance, gut imbalance. Everything right now is a very hot topic in healthcare. The gut bacteria, the gut health, be kind to your health, plant-based foods. So that is seen. Let me see. Sorry. And in health, oral microorganisms are poor colonizers of the GI tract. And there's a bacteria like P. gingivalis that could, once it gets into the stomach, it could actually live and continue to cause problems in the stomach and avoid the acidity of the stomach. All right, so then there's the endothelial dysfunction. Endothelium is basically the cells inside our blood vessels. Can also, they change during inflammation. And this is endothelial dysfunction is how atherosclerosis happens. So also this same pathway that we see through where how atherosclerosis happens, it's harder to dilate blood vessels and so things like because it affects the nitric acid, nitric oxide of the endothelial cells, and which are what cause dilation. So this could be also another link, increasing the disease severity of and mortality rates in COVID patients, especially with diabetes, people who have hypertension and lung disease. So it just happens that people who have heart disease, diabetes, obesity, ironically, those are also the people that are dying. Those are those people have a lot of other issues that and this is one of the issues. Next thing, this is kind of again the overview, and you can see that kind of everything we talked about. We have bacteria from the gums. You can be aspirated. It can go into the bloodstream. It can cause the cascade or the cytokine storm, releasing CRP. Remember, that's C-reactive protein. That's not good either. IL-6 and a couple of others like TNF alpha and others. And directly link, again, that directly, IL-6 directly can cause respiratory complications. And then you have the indirect link through the blood vessels, through the gut, which indirectly challenges or harms the lungs, which the worst condition the lung is at the time people are in the hospital from COVID, the worst chance of them surviving. So treatment, given the transmission rate of the virus and the 22 times higher risk for COVID respiratory complications linked to high IL-6 levels, we have to do everything that we can to decrease inflammation. This should be a priority. Also, periodontitis is considered a risk factor for cardiovascular disease, hypertension, diabetes. So these are also the people that have comorbidities. So we want to do whatever we can to keep their mouths clean right now. That's the main point. Now, people are they're staying away from the dentist because they see charts like this on the news. But our job as dentists is to say no. You have to come to our office now more than ever, and explain to them why. So I created an email that I will have available that you guys can send to your patients to basically let them know of this article that's been recently published, so they can look at it for themselves. At the end of the article, it's not so scientific. It goes solutions, general overall, so I kind of break it down so even the general person could read it, the common person could read it. But we need to bring patients into our office more than ever. That's one of my missions and goals with this, is to inform the public and try to get people back into the dental office in a safe way, and indirectly, it's a win-win for everyone. Everyone gets help. So genetic testing is really important right now, and this is one of the I wouldn't say solution, but it's one of the ways that you can check again to see your risk. there's a lab that we use that's very popular. It's the oral DNA lab, I called them. I spoke with the owner. He's a medical doctor. He gave me his data. He showed that of the samples that have been sent, of the 12,000 samples that have been sent to his office that have checked for IL-6 levels, again, IL-6 risk level, 45% of people had a GG, which is a high risk allele. 41% have a intermediate or medium risk, and 13.8% have a low risk. Again, these are people who have issues with their mouth, so we know that it's going to skew, and it's not as impactful of a data as a randomized controlled study, but in general, the GG serotype is found in 71% of severe periodontitis patients and 50% of moderate periodontitis patients. So there is a link, and it's good for people to know if they're high risk. Also for COVID, they have a higher chance of that cascade and their cytokine storm from going out of control. That's basically how to put it for their patients. This is the lab that report when you send it to the lab. They give you this report. It tells you which bacteria are in their mouth. It tells you interleukin-6, high, intermediate, or low. It talks about which part of their body are affected by the bacteria in their particular mouth. I do this with a lot of my patients during my consultations. We have it done before they see me, and it makes my consultation much more productive, easier. The chances that you can tell them whatever you want, but when they look at a piece of paper and it basically shows that they have, Tannerella forsythis, P. gingivalis, and that's connected and linked to a higher chance of, certain cancers, and it's also linked to higher chance of heart attacks and strokes, and also may be linked to diabetes. And so when people see it like this, they're gonna say, "Okay, doc, let's do whatever we need to get me healthy. I don't want this stuff. I don't want to deal with this stuff." So great tool. Again, this is the actual IL-6 genetic report. You can see it gives some information to the patient and whatnot. I don't want to get into that much, but let's talk about solutions, okay? So based on the scientific evidence provided in my article and on the guidelines from the ADA, we kind of came up with some solutions that we recommend for offices and dentists like yourself during these unprecedented times. We want to basically promote oral hygiene to decrease the burden of bacteria and screening for untreated periodontitis. Patients should be encouraged to brush their teeth twice per day for a minimum of 2 minutes and perform interproximal cleanings. So those little proxy brushes are good for people who have spaces between their teeth, but nothing's better than actual floss. And when they floss, you have to show them how to floss. They don't just go up and down, or else we have a papilla. So you literally want to go on one side of the papilla and then on the other side of the papilla. You don't want to go up and down and cut the papilla in half and cause bleeding that way. So they have to wrap around like the shining a shoe on one side, wrap around like the shining a shoe on the other side. And I'm big on water picks. I like to finish it off with a water pick. I recommend putting some either hydrogen peroxide inside the water pick, about 1/3 peroxide, 2/3 water. And I like it to be the last thing they do before they go to sleep, because during the time that they're sleeping, when their mouth is dry, is when it's best to have a film. It's like a you're cleaning a car, you want to not only wash it, you want to wax it at the end. You want to make sure things, if they fall down on it, they kind of just don't stick. So that peroxide film hanging out on the teeth protects the teeth the first couple of hours of sleep when the mouth is dry. So some of the solutions that we were talking about are good oral hygiene, like for example, povidone iodine rinse. Okay, there was a study that was just released that shows if you put a couple of teaspoons of it in a cup of water, or in like a 3/4 full water, you can kill entirely COVID in the mouth. So again, iodine or betadine. Put it in a cup, a little bit, rinse, gargle with it, and spit. Also, the company also has a nasal spray, a betadine nasal spray that you could spray into the nose that will help reduce the virus there. Also, we talked about, again, the brushing and flossing and how to floss earlier. But as far as the cleaning, again, this is not the time to do your very simple prophies. This is the time that you numb, get the patient numb in certain areas, go in for a nice good scaling and root planing. This is a time where you want to get your probe, get maybe a neighbor's probe, check for furcations, check for any bacteria, check for any, maybe use a CT scan so you can see if you find any lesions, periapical lesions near the sinus. Again, these lesions, most of them are asymptomatic, that most of them are not causing any pain. So we want to be proactive and preempt that bacteria from entering into the system. And when a pocket, after a scaling and root planing, when a periodontal pocket is 5 millimeters or more, is when you want to refer to a periodontist. And again, some offices are very good about referring, some aren't. This is a time when your patients will value you more if you're proactive. And I think you might have some stuff going on in the bone, and you show them in the X-ray that they have some fuzzy area, some gray area that's interproximal of, let's say number 20 and 19. Let's have the periodontist check. He might need to go a little bit deeper than where myself or the hygienist can get to. So that's key. Also, genetic testing that we just talked about, so checking the IL-6 risk level. But how about we find out what the IL-6 is in their blood right now? So they can maybe go to the doctor and get their CRP checked, get their IL-6 levels checked. If it goes above 80 is when it goes on they go on a ventilator. Let's check to see where they are right now. No one's talking about that. If IL-6 is the predictor for ventilation, if IL-6 is what causes people to go down into the cytokine storm, let's find out. Let's see where your IL-6 levels are at today. You can do a blood test and find that out. The next thing is for people who don't want to come into the office very easily, virtual consultations and mobile dentistry. So I know I'm a big part of that solution. I advise for Dentulu, a tele-dentistry app, which they have a lot of amazing things in the pipeline, solutions. So, talk to them, talk to your patients at home, give them some advice. And then sometimes in life, in order to make something happen, you have to take baby steps. So you start with, a phone call over the phone or face-to-face, get them comfortable. Then next thing you know, they come in. And next thing you know, they become a patient for life. The next thing I want to talk about that, again, people don't talk about too much as far as in dentistry, but this is what I was talking about when I say our role is going to change. I talk about diet and vitamins with almost all my patients right now. Because they say, Doc, what do I need to do to not die? I say, let's reduce inflammation. How do I do that? Maybe steroids, maybe inhaler, if they get COVID. But to preempt it, obviously, decreasing it in their mouth. And then lifestyle. How about you decrease the inflammatory foods that you're putting in your body? You know that meat is inflammatory, chicken's inflammatory. We know that turmeric is anti-inflammatory. We know that sugar, literally sugar and processed carbohydrates increase IL-6. So again, they should know that. You know, sugar is one of the worst things that you could put in your body. Not fruit sugar, not the one that's in fruits, but sugar that's processed sugar and processed carbohydrates increase IL-6. These are the vitamins I'm recommending my patients to take. I tell them to take vitamin D3. Vitamin D3 is very good for the immune system. It's very good for when people get COVID and to help the immune system when you get COVID. I like a nice strong dose, like 5,000 milligrams a day. If they get COVID, I'll tell them increase it to 10,000 milligrams per day. Vitamin C, you know, at least 2,000 milligrams of vitamin C a day. And you know, up to 3,000 milligrams of vitamin C. Zinc, as we all know, zinc is very important. And in fact, many of the drugs that they're giving to the patients, it requires zinc to fully work, like hydroxychloroquine, you know, Z-Pak. It's a part of like the, you know, remdesivir. There's multiple medications in different countries that are being used. And then, of course, turmeric. As far as there's garlic. Garlic is very anti-inflammatory. Onion is anti-inflammatory. Ginger is anti-inflammatory. This is the time to be taking those. So the take-home message is overall gum disease. So our study is finding a definitive link between COVID-19 complications and chronic gum disease. And gum disease can make lung disease worse. Inflammation in the gums can be silent and contribute to body's overall inflammation. The bacteria in the gums travel through the body and spreads this harmful inflammatory IL-6 protein. And you got to use those words when you're talking to the patient. It's a harmful inflammatory protein. And when IL-6 levels are high, it is a predictor. It predicts respiratory failure and a 22 times higher chance of putting patients on a ventilator. And COVID-19 is more serious in the presence of inflammation. Poor plaque control can negatively affect the lungs of hospitalized COVID-19 patients. And with that, I think that dentists should be getting even in the hospitals to check people's gums. Because if it's the hospitalized patients that are at the most risk, why not get a cleaning while they're there? You know, it's time for the doctor to step up, the dentist to step up and show our value and show that we're really, you know, we're part of the solution and we're part of the overall solution. The mouth and the teeth and the gums are an organ, just like any other part of the body. There's a blood supply that's the same blood that reaches the foot in 1 minute. We need to think systemically, comprehensively. Again, that's my mission moving forward, the goal, and again, the take-home message, which we kind of went over, but again, these are just I went over those already. But we are taught to analyze body systems and parts separately and to change one area at a time. Such an approach often ignores the interconnectedness of the systems in the human body. And it's time for that to change. So thank you everyone for listening to this presentation. Again, this is the quote. Thanks for listening. You can find my email and my information. You can contact me, and thank you.
Yeah, Dr. Molayem, thank you.